It's a great time to be a rugby league fan, isn't it? Especially if you follow South Sydney. Apart from having a highly successful club here, the reason we're here at the South Sydney Juniors is because President Keith McGraw, who I don't think is with us today, and his board are leading the way in Australian sport in adopting the latest technology and the protocols to deal with concussion for 3,000 or so junior footballers in the South Sydney district. Long overdue. We'll tell you more in a moment about the screening procedures, these groundbreaking screening procedures for concussion. But to kickstart the morning, let's welcome Earl Evans, who's the CEO of Shaw and Partners Investment Service. Earl, come on up. Thank you.
Thank you, Ray, and pleasure to be here. And for all the people online, you're in for a very, very fantastic and informative morning, which is awesome. Shaw and Partners Financial Services likes to actually put back, get involved in the community, and this is something that not only from a fundraising perspective, the firm has actually done quite a bit on in regards to helping finance this or being involved in issues like today, which are obviously, it's a global issue. It's a bit like we're just talking a little bit before about smoking. You know, people denied smoking was an issue, and it took conciliatory views from governments to actually get this thing to be stopped. Concussion is very, very much the same, and I think that's why today is so important. So back over to you. Thanks, Ray.
Thank you, Earl, and thanks to Shaw and Partners for sponsoring. Concussion, as Earl said, is probably the most critical issue facing world sport today. Yet Australian football codes have been slow in facing up to this crisis. Even now they can't quite make up their mind on how to truly deal with the problem despite this duty of care that they all have. Around the world, clubs and fans and coaches and players themselves, TV networks, billionaire owners all want their concussion players back tomorrow, if not yesterday. Bugger the players. Our team needs you out there to win. In a moment, we'll hear from a man who's one of the world's leading authorities on concussion in sport. Dr. Jon Patricios is our keynote speaker, waiting for us in Johannesburg. First, though, so they can also hear his words of wisdom, let's bring our own select panel to talk about concussion shortly. Come up, gentlemen, please. Greg Rosenbauer is a highly skilled physiotherapist who's worked everywhere, it seems, from Lord's Cricket Ground in London to the Japanese National and Olympic High Performance Program in Japan. He's also the co-founder of something called Your Brain Health. Dr. David Stevens is the head of medical and research at NeuroFlex. Stephen Fenech, I mentioned, is a widely trusted techo journalist and a former Rabbitohs player who's passionate about brain health for a good reason, as we'll hear. And our fourth panellist is a legendary Souths player who still looks like he could run out against Cronulla on Saturday night. Please, Ian, would you do that? Ian Roberts, apart from playing for Australia and for Souths and Manly and Wigan and North Queensland, he's spoken out on the issue of concussion in sport. You've undergone a series of brain tests. Why did you do that and what have you discovered?
Listen, I feel like a bit of a fraud being up here. I'm no expert. I mean, I can just talk about my personal experience. I originally started to realise I had some issues. It would be a little bit over 10 years ago. I was living in the States at the time. I was over there for about 4 years. I was trying to crack it as an actor, but I had noticed while I was there that I was a bit slower in the auditions, or I wasn't as sharp. I also had 2 episodes where I lost some time. I was one of those was I was driving the car, then it felt like the next moment I was at home, and I had another situation like that at home where I was in the shower, then I was in bed, and half an hour had passed between. So that kind of really concerned me. I came back and I was I spoke to my doctor. I went and had a whole load of testing done, and they did find that there was a problem. Ever since, I've tried to speak up about this because I do believe this is a type of thing we've got to keep poking the bear. You know, the research and the science is out there, and we can see how dreadful the consequences of head knocks and CTE can be long term. I'm kind of flattered that I'm able to help in some capacity.
Ian, I remember when I first started as a journalist, I was covering boxing at Sydney Stadium, and a fighter would get knocked out and not fight for 3 months. You guys get knocked out, get some smelling salts and go back on.
It was a very different time back in the mid to early 80s when I first started playing. I mean, quite literally, you get knocked out and the trainer would run out with a wet sponge and hit you in the back of the head with a wet sponge, and you're off. You're good to go again. I have a story. We were playing. It would have been 1986. We were playing Canterbury at the Sydney Cricket Ground. It was the Anzac Day game. It was a beautiful day. And I've only seen the tape. I don't remember the game, but I took the ball up and David Gillespie, the cement. I called him cement because he used to hit like a cement truck. He cut me in half. And all I remember is waking up and it was a beautiful day and Maury, our trainer, came out and sat me up and I just looked in the sky and I was like, God, it's a beautiful day, isn't it, Maury? I felt like I was at Bondi Beach. But we can laugh about it, but it's not funny. It is one of those things. We kind of live in that world where, we look back and we can laugh. We try to laugh about those situations. And that was a really serious injury. I was out cold basically for a few minutes. But I went off for 5 minutes and I finished the game. I came back on within about 15 minutes. So, I don't know what it is. I think we need to push this conversation forward, particularly I can only speak on behalf of the men's game. I think a lot of people see it as a weakness or demasculising. I don't know. A lot of the older generation don't like to speak about it, but the evidence is out there now and we can see how catastrophic this can potentially be.
Did you ever think you were doing damage to yourself or just to your opponents?
I don't even think I thought of it like that, Ray. I don't even think I thought of it about damaging myself. I didn't. There was never that perspective that there was going to be a long-term problem. We just weren't about that then. We didn't have there wasn't the research, and it wasn't spoken about like that. I mean, this is a serious injury. It's like getting an ACL issue. It's like having an Achilles, and these are serious injuries, but we don't treat it like that.
No, okay. Well, let's stay with the football players. Stephen, in your own experience, how many times do you figure you were knocked out on the field?
Myself, a few times, but nowhere near as many times as my brother. Like Mario used to joke he's had more hits than Elvis, and the amount of times he was knocked out. And as Ian was saying, the mindset back then was that you just got up and got on with the game. Yep. If you didn't continue playing, they thought you were a coward. Unfortunately, that thinking has resulted in my brother now having issues. His short-term memory is basically gone.
How old is he now?
He's 62 now, yep. But he's been struggling with this for a few years. And he can remember every single game he ever played, but won't remember what he asked you 5 minutes ago. That's his situation now. But you know what? He's still very physically healthy, fit. Yep. He's got a great routine. He's surrounded by his family, so he's living a great life. But he does need care. And if technology like this was around back when he was playing, when Ian was playing, when I was playing, then we'd have a whole different story today. We're able to see the effects. Today there are protocols in place, and these guys will talk in more detail about the science. But the beauty of NeuroFlex is that it can provide this objective data that can tell quite accurately a safe return to play, how long you need. And just to explain what the South Sydney Juniors have done, the South Sydney Juniors have adopted NeuroFlex and they've tested nearly 3,000 young players who now have this baseline record that they're able to carry through their entire career. So whether they continue playing for a year or go all the way to first grade, if they're concussed again, they do another test and they can see exactly how far from their normative, their baseline they've gone. And that gives the doctors a lot more information, and it's objective data rather than just asking a player, as it is today, where it's subjective data. How are you feeling? I'm good. I want to play. How many fingers am I holding up? I'm going to tell you 10 words. That's the subjective data that's used now to decide whether they play or not. So now this tech is, I think, critical to help assure that current players have the right information, but also too, post-career, they're not going to be struggling, having problems similar to my brother right now. Right. So there is knowledge is power, I think, in this area. Well,
let's go to Dr. David Stevens. I think the professor's going to call NeuroFlex the new gold standard. What makes it such a game changer?
It ultimately provides objective data for what is currently quite a subjective process. I'll be honest, I was appalled at how they identify it. It's a questionnaire, essentially. It's a questionnaire that research has shown that players, they tank at baseline or they sandbag at baseline, so they intentionally do very poorly. And then likewise, the questionnaire is publicly available online. So, you can very easily just memorise it. So, technology like NeuroFlex, you can't tank it, you can't memorise it. It provides objective data and it shows functionally how someone's neurological performance has changed over time.
All right, Professor Jon Patricios has been in sports medicine for almost 3 decades. His CV is about as long as your arm. He's currently a director of sports orthopaedic surgery in Johannesburg and a professor of health science. He's a sports concussion consultant to World Rugby and a board member of the highly respected International Concussion in Sports Group. In his spare time, he's also the editor of the British Journal of Sports Medicine. So I said, joining us from Johannesburg on the big screen to tell us the latest, what he calls the new gold standard when it comes to concussion care in sport. Would you please welcome Professor Jon Patricios.
My name is Jon Patricios. It's a great pleasure to join you. And I'm really very, very honored to be invited to address this gathering, and also want to thank you very much for highlighting the issue of sport-related concussion. But my brief this morning is really to talk to the issue of sport-related concussion and hopefully try and clear some of the clutter and the noise around sport-related concussion. And I think that concussion is a mystery to many people. And in my mind, the reason for that is that there's no visible wound. Nevertheless, concussion is really a hot topic. And if you aren't aware of a lot of what's going on in the conversations around concussion, if you're not seeing that there are movies being made about it, if you don't see that there are issues in both short and long term with concussions that aren't managed properly, then you're probably living under a rock. So how do we clarify what the truth is around concussion and what the science is that should be informing our decisions in sport? Does it come down to this? A CAT scan that shows us the brain. And anybody who has been associated with a player who has a significant head injury will know that they're often scanned when they go to the emergency room, and inevitably that scan is normal. And as I said earlier, there's no clear visible wound, and that's the difficulty. So if I were to schematically represent what's happening in that brain under normal circumstances, what happens is that there's a signal that arrives at a nerve in the brain. That signal is carried across from one nerve cell to the other. And that process is happening approximately 97 billion times a second. So it's an extremely complex process. Now, in the case of a concussion, what happens is that there's a disturbance, we think, of the transmission along that nerve. And so there's a tremendous disruption, not so much in the visible structure of the brain, but more in the function of the brain. And so it's up to us to try and look at brain function rather than brain structure to determine what's happening. The good news is that if we can identify those areas that have been affected and manage it correctly, then that area of the brain that's been affected can return to normal after days or weeks. I've simplified it quite considerably for the sake of getting the message across. So why is such a fuss being made of sport-related concussion? Well, I can think of a few reasons. If you don't manage concussion appropriately on the field and you allow players to continue playing, that injury can rapidly become worse. And they might suffer from what we call cerebral edema, or what some people describe as a second impact syndrome. In other words, if the brain that has been injured takes a second impact before it's recovered from that first injury, the brain injury can become much more severe. The other important point is a good selling point if you're trying to tell coaches why taking concussion seriously is important. And that is that the research now tells us that concussion, playing with a concussion, will impair your performance. So your player is going to be of less value to you. And is also going to increase their risk of further concussions, but also of other injuries. So you're more likely to have an ankle or a knee injury if you're concussed. And so treating that concussion seriously is important, obviously to protect the brain, but to protect the rest of the body as well. The big issue out there in the media and social media is the potential chronic sequelae of concussion. And we need to take this increasingly seriously, and we're learning a lot more about this, the neurological and psychological effects. And for those of you in the field, this has significant medical, legal, and insurance implications as well. We talk about persisting symptoms, if those symptoms related to the concussion go on for more than a month, and those can become very disruptive to any individual's life. And because we know so much more about concussion now, if we don't take it seriously and we don't put action plans in place, we're at risk of our sport losing credibility. We're at risk of losing credibility as institutions and as individuals. So to enable us to sift through the science, we have a group called the Concussion in Sports Group, which is a group of doctors and scientists from around the world that every 4 years meets and sifts through the science. We had ultimately a group of about 108 experts from around the world that contributed to a series of 10 papers, which were published and actually were a summary of about nearly 80,000 published original research articles. And ultimately, we published what was called the Amsterdam Consensus Statement. This is a summary of all the published evidence at the time of that conference at the end of 2022. None of that makes any sense or is of any use unless we take that information from the Concussion in Sports group that was discussed and presented in Amsterdam, and we apply it in scenarios such as this. So I'm always very grateful for opportunities to translate knowledge and convey what was put into those research articles in a forum such as this. That process took a number of years, as I said, and without going into the detail, I just wanted on this slide for you to appreciate that this is not a group that just gets together over a day or two and discusses information and publishes it. It's a sifting through of scientific information that is published across the world and is rated in terms of its risk of bias and its quality of evidence before it is included in the consensus statement and systematic reviews. The process leading up to the Amsterdam statement was particularly robust. There was a lot of external review of the process. The voting for the included points was anonymous. We included people who had alternative viewpoints. We put a lot of emphasis on declaration of potential conflicts of interest. We included athletes in the conference to hear what they had to say. So we tried to keep it as robust as possible in terms of the process. Ultimately, it really comes down to this, and that is trying to evaluate what's happening in the brain of an athlete whose brain is injured in a situation such as this, to determine which areas of brain function have been affected, how that athlete is recovering, and what we can do to try and make them better and prevent this injury happening again. Both in the acute situation, it's important to initiate management, but also to monitor them in the long term. And I'm going to discuss a little bit about how we do that. So when we talk about setting a new global gold standard, we're not just talking about a single piece of technology. I think that's very important. That technology is only useful when it's put into a scenario where doctors are able to evaluate various areas of brain function through various questions, various tests, and various examination techniques, and the technology is then added to that. And that's what this consensus statement emphasizes, is that evaluation of concussion is what we call a multimodal process. you have to look at different aspects of brain function, because some athletes may be affected in terms of their balance, others in terms of their memory, some in terms of more subtle things like emotions. So we have to look at all of what we call these domains or different modes of brain function. So in the next few slides, I'm going to summarize or highlight some of these aspects. How do we reduce the incidence or the risk of concussion? How do we recognize or diagnose concussion? What are the critical elements in identifying which athletes are removed from the field of play? How do we reevaluate those athletes? What is the role of rest and what is the role of exercise? How do we determine return to sport? And what are the aspects we need to take into account to reconsider an athlete's participation in sport, both short-term and long-term? So the first is reduction or risk reduction or prevention, if you like, of concussion. And this often comes as a bit of a surprise that concussion can actually be prevented. Mouthguard use has a role to play. This is good research which comes from ice hockey, particularly youth ice hockey, that limiting contact exposure is important. And one area we have under our control is on the practice field. What we call neuromuscular training, in other words, a series of movement control exercises that are implemented as part of a warm-up, has been shown in rugby to help reduce the risk of concussion. And certain exercises, including coordination exercises, rugby-specific exercises, and neck strengthening, should be incorporated as part of conditioning. And then very importantly, as a club, as a school, as a community, having concussion management strategies and policies in place helps reduce the risk of further concussion. In terms of being able to recognize an athlete with potential concussion, and that's an important point. You don't have to make a diagnosis of concussion, particularly as a non-medical person. You just have to be able to recognize potential concussion. We have a series of what we call tools to be able to do that, and those are for both medical and non-medical people. And those allow us to recognize concussion and then reevaluate the athlete. Now, those tools are called the SCAT tools or Sport Concussion Assessment tools, the Child SCAT for ages 12 and under, the SCOAT or the Sports Concussion Office Assessment tool for 72 hours and onwards for medical personnel, and then Concussion Recognition tool, which is for non-medically qualified people. And they're all freely available online. I'm not going to go through the detail of this SCAT-6, but I just want to give you an idea that they evaluate various aspects of brain function, and the SCAT-6 is designed to be completed in 12 to 15 minutes on the side of the field. So it's a pragmatic test for medical people. The SCOAT-6 or Sports Concussion Office Assessment tool is a new tool for medical personnel that's been designed for a more comprehensive evaluation. This takes between 30 and 45 minutes. And as you can see, they evaluates a whole spectrum of potentially involved areas of brain function. An important aspect of the concussion meeting was to evaluate the role of rest and exercise. And this is an area that's changed significantly. The days of putting a concussed athlete in a dark room are gone. And in fact, the research is now showing us that after an initial rest period of about 48 hours, light physical activity and cognitive activity is actually beneficial. So limiting screen time has been shown to help for the first 48 hours and not much more after that. And actually introducing aerobic exercise in the early stages from 2 days onwards after the injury actually helps recovery. So this has turned the way we manage concussion, excuse the pun, on its head. And so we now use exercise, even if there's mild exacerbation of the symptoms, as an intervention in terms of treating concussion. And that's very, very important take-home message. It feeds into our return to sport protocol. And you can see in the light blue first 3 stages there that we actually use exercise as an intervention. Quite important in terms of a change in our thinking. And this should really be a medically supervised process with people who understand return to sport in concussed athletes, and will allow you in a very safe way to gradually reintroduce exercise and then contact training into that athlete's life again. Similarly, there are return to learn guidelines, bearing in mind that a lot of these are young athletes studying at school or university. And again, in a stepwise fashion, we don't cocoon them. We allow them to reintroduce cognitive or thinking activities into their life in a stepwise fashion. The critical area that is being highlighted, I think, in the media a lot is the aspect of potential long-term effects of concussion. And this is playing out even at a school and a youth club level, where people are talking for a ban on contact and collision sports. And I think it's very important to evaluate the science behind this and be able to have conversations around the potential long-term effects that are not emotive, that appreciate the complex and importance of these questions, that understand the ethical and scientific challenges that go into determining potential long-term consequences without having longitudinal studies to support this, and to use interdisciplinary input to making objective decisions for each athlete. So the Concussion Sports Group, in terms of evaluating this important topic, looked at various aspects, looked at potential mental health problems, neurological conditions and diseases that are associated with contact and collision sport, the aspect of what's known as CTE or chronic traumatic encephalopathy. And the conclusions were from the research available that actually the benefits of sport far outweigh the risks. And that's why managing concussion is so important, because if we can do that, we're likely to significantly reduce the long-term effects of concussions. And so amateur and professional athletes are actually not at increased risk of psychological disease and suicide. Amateur athletes, and unfortunately the research is restricted to male athletes, are also not at increased risk of neurological degenerative brain diseases. But in certain cohorts of professional American footballers and soccer players, there does seem to be a slight increased risk of some neurological diseases and dementia. In the next couple of slides, I just want to talk a little bit about our South African experience in rugby, which in South Africa is predominantly rugby union, because I think it talks to a number of the initiatives that your group is actually employing as well. So in South Africa, rugby is really the leader in terms of managing concussion and potential head injury and its consequences. World Rugby has very robust concussion protocols, and in South Africa, we have a program that's called BoxSmart. BoxSmart is a generalized injury intervention program that focuses predominantly on head and neck injury. Now, the unique aspect of this, and I think it will be relevant to many people in the audience, is that it targets every coach and every referee that's involved in the game of rugby in South Africa. So what that means is that every 2 years, everybody who coaches rugby, whether you coach the national team or you coach an under-9 team, has to reaccredit themselves in terms of upskilling their knowledge on rugby injuries, particularly head and neck injuries. And there's a course they have to undergo. That course, thanks to COVID, has been introduced in online form as well. And so it's now extended to players, management and supporters who can upskill themselves. But for coaches and referees, it is compulsory. South Africa has also introduced what we call a blue card system. In other words, in the community game, referees, officials are able to show a blue card if they suspect that a player has sustained an injury that might result in a concussion. And they're then referred for medical assessment and cannot come back to the game of rugby until they've undergone that assessment. There's also a process of collaborative research where various healthcare providers are upskilled through the latest research. So rugby is certainly leading the way in terms of upskilling people across the spectrum of the game. We have a network in South Africa called Sports Concussion South Africa, making the protocols that are available to professional athletes available to athletes at all levels of sport. Our role is to expand clinicians' knowledge and to improve access to care through educational initiatives, both informal and formal, and through upskilling clinicians such as school nurses and doctors. And so we work closely together, Sports Concussion South Africa and South African Rugby, collaborating to care for our athletes, educating, instituting acute management protocols, highlighting the work of BoxSmart, and importantly, creating a network of doctors across the country that are skilled in concussion management. And so we have their information available on our website, and depending on what province you're in, you have access to these doctors. And increasingly, we're looking at a program to initiate monitoring of the long-term brain health of our athletes as well. We've initiated a process utilizing the NeuroFlex technology as well for the first time in baseline testing across schools, particularly in the province where I am. And we've now tested over 2,000 young athletes since the beginning of this year. We're utilizing this technology, which was referred to, which is a very, very objective and looks at various aspects of brain function. And I'm going to explain why using this technology, in my mind, is quite important and helps us. And to do that, I'm going to go back to this model of the nerve function and why technology helps us, particularly technology that looks at the function of the eyes and how it interacts with our sense of balance and our awareness of our position in space. So if you go back to that original model I presented, that simplistic model of the transmission of the signal across the nerve cell and between different nerve cells, that's happening 97 billion times a second. And you look at those areas of the brain that affect the visual system that interacts very closely with the balance system and in turn acts very closely with our movement. We call that the vestibular-ocular-motor system. And vestibular-ocular-motor sensitivity refers to how we're able to measure how well the eyes and the head and the balance system and the body move together. And you can imagine that that's critical to function as a sports person. So if as a sports person, either your visual system or your balance system or your ability to move is affected, you're not going to be functional. So if we're able to test those three aspects, we're going to have a significant insight into being able to evaluate that athlete and then also facilitate recovery. That for me is a very important reason to utilize that sort of technology in terms of obtaining important information of how that athlete functions normally, and then being able to actually intervene in terms of making that patient function better until they're back to their baseline level of function. So ultimately, we're here to try and make a difference. So whether you're working with para-athletes, whether you're a busy GP in Sydney, whether you're working on the sideline as an athletic trainer, we're all here to try and make a difference. And I think Nelson Mandela summed it up when he said, sport has the power to change the world. It has the power to inspire, to unite people in a way that little else does. And so I'm very pleased to become involved in the Your Brain Health Network, because I think at a community level, these sort of initiatives in bringing networks of scientists and clinicians together will ultimately make the difference to particularly our youth athletes. And so as a sports leader, as many of you are, I'd ask you just to take the information from the global concussion scientific community and make sure you can upskill yourselves and ask yourselves, do you understand that concussion can be prevented by having the right policies, the right neuromuscular training, by using the right equipment? That as communities, as clubs, you should have the right multimodal assessments in place, both in the acute sideline and office environments. that you should have policies that dictate return to learn and return to sport, that as leaders you need to be able to discuss the treatment of concussion, that you need to know the role of exercise in making concussions better, that we need to have rational discussions around potential long-term effects, discuss when players should be retiring after multiple concussions. At your fingertips, you have resources that include links to the latest scientific information that is free, freely accessible tools, video abstracts, podcasts, webinars, which are used as educational tools. And you should, as clubs and schools, have a network of doctors, physiotherapists, psychologists that are available to you to manage your athletes in their best interests. I hope you can take the information from the Concussion in Sport consensus and put it into the area that is most important, and that is in your communities. And so I'm very grateful for this opportunity. I look forward to the questions and the interactive panel discussion, which is always for me very exciting. So thank you very much.
Thank you, Jon, very much indeed. 100 questions from what you've talked about today. Let me just ask a couple. In Australian football, if someone gets a head injury on the Saturday game, in rugby league they're out for 11 days. In Australian rules they're out for 12 days. In other sports they're out for 21. Is that nonsensical? Is that a stupid policy?
And remember, that's a minimum of 11 days, a minimum of 12, a minimum of 21 in community sport in Australia and certainly in world rugby. So the answer is really that player is ready to go back when she or he is ready to go back. And that can only be determined by a multimodal evaluation, preferably by a clinician who understands concussion and preferably compared to their baseline. And that will differ. So you can take two very different scenarios. You can take a 26-year-old rugby player who suffers his first concussion and has no other contributing factors, or you could take a 16-year-old who suffered 3 concussions in the last 18 months and also has attention deficit disorder and is being treated for anxiety. So those scenarios are very different and have to be treated with different levels of sensitivity and clinical intervention. And so the individualized approach to concussion is very, very important. So these blanket timeframes are really minimum guidelines, but did not take away from the fact that we need to individualize our assessment and our interventions.
We had the Australian rugby league Kangaroos captain with a head injury last weekend. That's the 10th that he's had in his career. Is his body trying to tell him something?
Yeah, I think that we know that the greatest risk factor for concussion is previous concussion. That's no different from any other injury. And if 10 concussions in a career is the number, then that player has to be evaluated with increased sensitivity. I think that the evaluations need to be robust in terms of looking at every aspect of brain function. There needs to be some assessment of why those concussions are taking place. And inevitably, we probably find that players are going back without recovering certain aspects of brain function. And I spoke to critical areas like vision, balance, and movement and reaction times as part of that. Now, that's an area where technology can help in terms of looking at those very subtle aspects of brain function. So with the technology we now have available, we can look at things like reaction time. We can look at things like how well the eyes are moving together, how well the eyes are moving with the head. And we can compare that, hopefully, not only to baseline, but to normative levels and monitor that athlete. And then increasingly use that technology and other interventions in terms of rehabilitating that athlete. And we never thought of that before. And I would probably hazard a guess that many of those previous concussions were not rehabilitated, whereas we now realize that concussion is a treatable condition. And if we identify those areas of function that have been affected, we can correct them and reduce the risk of further concussions.
There'd be many parents hearing the story of Ian Roberts tonight and Mario Fenech, who would say, I'm sorry, my son or daughter's not playing a contact sport. They'll go and play golf or tennis. You say the advantages outrun the disadvantages.
Yeah, I think the benefits of team sport are considerable. I think the benefits of contact and collision sports for many athletes are considerable as well. There's an appetite for playing contact and collision sport. No one's forcing these athletes to play. They want to play contact and collision sport, and there is a perceived benefit in playing these sports. And so I think it's incumbent upon those of us that are involved in the medical side in terms of caring for these athletes, but also in terms of the policies to make the sport as safe as possible. And so where that comes in is in terms of making the rules as safe as possible. So we know that the tackle is the area in which most concussions occur. So to make the tackle area as safe as possible. And then in terms of identifying, recognizing and removing those players so their brains are not subjected to further injury. I think in doing that, we can make the game as safe as possible, allow the benefit out of them that they know that they're getting, that we know we got when we grew up with these sports, but in a much safer environment than it has been historically, when perhaps a lot of these stories of athletes with long-term effects have evolved from.
It was mentioned earlier that we've seen medicos and scientists over the years tell us that there was no connection between cancer and smoking for so long. We've been told that there's no connection between man, 8 billion of us, and climate change. Are we dragging the chain on this issue of concussion as well?
I think it's important to say up front that repeated injuries to your brain is not good. And preventing brain trauma and collisions, particularly repeated collisions, is an important aspect of our role as policymakers and as medics. We shouldn't deny the fact that brain injury has potentially serious consequences. I think we need to say that up front, but equally we need to acknowledge that issues about long-term brain health are complicated by many aspects. I think there's 12 at least that go into determining potential dementia. And there are many general health conditions that actually reduced by participating in sport. I do know that the patients I deal with who play contact and collision sport are generally happy people and healthy people. Most of the retired players who played rugby in the past are healthy and happy people. We know from the research that playing sport, including contact and collision sport, is beneficial to your general health. We do see that there are cohorts of people who've been exposed to repetitive impacts that seem to have neurological, neurodegenerative, and psychological diseases. But I think we have a lot of questions still to answer about what cocktail of potential causes has gone into causing those conditions. One of them is almost certainly repetitive head impacts, particularly head impacts that haven't been identified or managed correctly. But I think to stop players and athletes playing contact and collision sport would take away a big aspect of many people's lives that is actually beneficial to them. And I think the better option for me is to make the game safer, to recognize and remove athletes who potentially undergone head injury, and to manage them in ways that allow them to return back at lower risk.
Yeah, Jon, thank you for your talk. Very, very amazing, really. But your country, obviously exceptionally good at winning Rugby World Cups. Do you think that certain countries are better when it comes to identifying and treating concussion?
Yeah, I think they are. And I think what we've realized in South Africa, where there's such a passion for the game, is that there has to be a cultural change. So you need to understand that winning at all costs is not acceptable. And I think the shift has come by understanding that concussion is a treatable injury, that we don't just keep players off the field for long periods of time, that while they're off the field, we intervene with specific multimodal treatments which actually help address aspects which might predispose them to concussion, and that this will actually help them perform better as athletes. So if we make that cultural change in terms of our approach, and we get buy-in from coaches, referees, parents, teachers, then I think it makes for a better approach to addressing concussion that is in the best interest of the athlete's health and performance. And that's been a big change in South Africa. We need to actually put science behind our regulations and actually support our athletes in ways that are going to make them better athletes and allow them to have longer durations of careers. But I think countries that have made that cultural shift are better at managing concussions.
Just a final one I've got, John. You mentioned 2000 model testing, multi-model testing of 2,000 South African young athletes. Why did you do it and what did you find?
So we're really doing it to try and obtain information on these youngsters' normal levels of function and integrate that into any decisions that we make in terms of potential concussion they might suffer. The fact that we have this useful technology now that we can use is firstly useful to us as a clinician, but it's also appealing to the athlete. They like doing the test. They see the benefits of utilizing technology to obtain insights into their brain function, and they and their coaches and their parents have greater confidence in the network that we have around them because of this tangible aspect of the technology that we now have.
Well, John, thank you. We thank you. Well, I know it's approaching 3 o'clock in the morning in your neck of the woods, so we thank you for your time and your wisdom today. Would you please thank our guest? Thank you so much. All right, let's go to you, Greg. Why did you feel the need to set up these clinicians in looking after the brain?
But as a clinician, we wanted to be able to assess concussion like we do any other injury, and we wanted to rehabilitate it using objective data to be able to guide our decision making. That is why we are currently using NeuroFlex, as we see NeuroFlex as the leading technology globally for us to be able to assess the vestibular oculomotor system. We're not looking to do that match day to diagnose a concussion. We're looking at doing that in our clinic 72 hours afterwards to better help guide our assessment of what systems have been affected, and also to be able to target our rehabilitation. What needs to be improved with this injured athlete? Is it that they've got a neck issue that needs to be improved? Is it that they have some eye tracking issues? Is it that their vestibular system is in deficit and they need some vestibular therapy? Is there psychological factors that need affecting? We have to look at concussion as a treatable injury, an injury that needs to be rehabilitated. And the good news is there's now technology and methods out there. And as we raise the level of education and understanding in the community, I think we can make a much safer within our community.
Let me ask Stephen and Ian then, why isn't multi-model testing compulsory? Why aren't the players' associations demanding it?
Well, I think there are protocols in place. It's just a matter of the different codes, understanding the technology, understanding how it can be deployed.
It's not, excuse the pun, but it's not brain science. It's not very difficult.
It's a no-brainer. How many times have we said that?
Yeah.
It's just using rugby league as the example, and you touched on the fact that there are parents who witness what's happening in the sport today thinking, well, I don't want my son or daughter to play that sport. With what the South City Juniors have done with NeuroFlex is given parents peace of mind knowing that their child's health, including their brain health, is of utmost importance if they choose to play rugby league in the South City District. Now, from being a junior player to a current player to a retired player, you can see the benefits of having this sort of protocol in place.
But my question was, Ian, maybe, why haven't the players' associations demanded this? If it's clear what happened to you and what happened to Mario, why aren't they demanding that every club has it?
God, Ray, I wish I had an answer that would satisfy everyone. I honestly believe there's still the economics of the game and sport that contribute to the answer in that. I'm sure everyone understands what I mean when I say that. And there's still, I still feel like there's a lot of fear in and around this space, and particularly anything to do with head trauma. Yeah, Ray, I wish this had been addressed, had started to be addressed when I was playing, but it's only recently, I'd say in the last 15 years, that this has become a topic for conversation now that can be had by all levels of administration within the sports industry.
David, I know it's your business and you've got skin in this, but what do you find when you go around and talk to the clubs, rugby league or Aussie rules or rugby? What's the resistance? What stops them? What's the roadblock?
A lot of the answers we get is we'll do what we get told from top down. Within AFL, we'll do what the AFL tell us, or within rugby league, we'll do what the rugby league tell us. And ultimately, what technology like NeuroFlex is trying to do and what the processes that, Greg and his colleagues are trying to implement is just making the game safer. But certainly you can use that experience to improve the safety of the players on the field, but then have that trickle down into the grassroots so that ultimately there is an improvement of safety throughout. And again, I'm a bit of a Formula One fan, and you look at the technologies that have developed in Formula One, anti-lock braking system. They even trialled, airbags and stuff. And that is now literally legally mandated to be required in vehicles because it improves the safety. So, it's technologies such as NeuroFlex that we're here to essentially try and make the sport safer. Because I will say, with the sports concussion assessment tool, it very clearly states on there that it should not be used to either include or exclude the diagnosis of a concussion. It literally says that a person can pass the SCAT test but still have a concussion.
Yep, okay. Sorry, Greg.
Can I just say that things are changing? We've had 4 AFL clubs come to us this year. We're off to Berlin in May to test the Euro Basketball League. We're off to Qatar testing their Premier Football League. We're now involved with a series of English Premier League football teams. We've had various motorsport organisations engage with us to improve the way that they're assessing and managing their head injuries. Horse racing, both in Britain and here in Australia. We're fielding phone calls every week from organisations that understand that they need to get a better clinical picture and better processes in place of how they're managing their concussion, and it is happening.
But Greg, how long do we have to put up with the Ian Roberts and the Mario Fenechs?
Yes, obviously we'd like it to happen faster, and we'll continue to try and educate and improve and grow with evidence so that organisations become more aware and feel more comfortable at engaging with what we're doing.
Okay. Any questions? Yes, sir.
Ray, recognising you're on the board of South Senior.
No expertise, I promise.
No, the question is addressed at you. So what conversations are you having at board level within South in relation to concussion tests? What pressure are you putting on the NRL to adopt the likes of technology like NeuroFlex?
I'm one of those who actually thinks Souths, for example, not just South's juniors, South should have adopted this as well, that we should have this testing as part of the regime. And I can't believe the Players Association isn't making a bigger noise and saying we must have it. Every club apart from the Dolphins and South Sydney juniors must have it. It just makes bloody sense to me.
Just a quick question. Where do insurance companies sit on concussions in sport? Surely at some point players won't be able to get insured if they haven't at least a baseline test. Where do we sit? And governments as well.
That's an evolving space. So I don't believe that insurance companies have made any holdfast statements at the moment, but I think that day is certainly coming where insurance companies will require extra levels of duty of care in regards to concussion management.
I'm actually in the insurance industry, and I've worked for international insurance companies across the globe in various countries. This is the most scariest thing that insurance companies are facing at the moment. They've dealt with asbestos in the past, and that's cost them millions and millions of pounds, dollars. This single thing is the biggest wave that they're afraid of at the moment, and they're denying it at the moment. That's what I was referring to earlier about the economics. You know, this is it is about, at some level, all the professional sports at some level admitting fault in the past, that advice and research and the like hadn't been followed or hadn't been taken seriously.
Sorry, Will?
This whole area of duty of care must be absolutely horrendously frightening for the whole of the spectrum of all sports. If we've got technologies and protocols, if a club or a trainer or a down to under sixes do not address the potential and understand their duty of care, I'm sure in the near future we'll be finding major court cases coming up where clubs have simply put this aside. Now, you can't get around duty of care. You can't get around ignoring it, being blind to it. You must address it head on. And I think the fear down to junior club sport that coaches might have a legal liability for or their club managers might have a legal liability for what they haven't attended to.
Yes, okay, yes. Comment on that, gentlemen?
We've already heard there's a few cases, I think, in the AFL coming up for exactly what you mentioned, the duty of care that wasn't received by the players. I think the clubs absolutely have a responsibility, just like they've got their assessment of injuries in every other part of your body. They should also have assessment of brain injuries, especially in contact sport like rugby league. Absolutely. I think this is a sort of technology that can actually protect the club, knowing that they're going through all these protocols that are providing the baseline testing, retesting when they're concussed, that information, that objective data that you can't fudge is critical. And the other scat tests where relies on a player's honesty most of the time. A player wants to play. If a coach says to a concussed player, "How you feeling?" then they're going to say, "Oh, I'm good to go." They might not mention they've had headaches all week or they're feeling really tired. So having technology like NeuroFlex in place just removes all of that subjective that data and replace it with objective data that you can't fudge. It's there in black and white for them to see exactly how you're travelling. Now, the 11-day stand-down period, I was talking to these guys before, they know more about the science than I do, but even after 11 days, and back me up, Greg, there are some players who may still need longer to recover than that.
If the brain's given time to heal, that after that period of time, approximately 65% of us have recovered from that incident. But which 65% of us is it? And so what we're really looking at being able to do is to be able to say that great news, individual A has returned to a healthy baseline, therefore we can say with confidence that they are safe to return to play. Unfortunately, individual B is still having an issue in this parameter, whether it be their balance, whether it be some of their mental health scores, whether it be their sleep, whether it be a vestibular-oculomotor issue. Therefore, we are suggesting that we further rehabilitate that person. We'll continue to track them. Once they have returned to a healthy baseline, we will also send them back. So in a community healthcare system that we have at the moment where we're unable to do that individualised approach, we have to throw some blanket rules over the community. But going forward, and certainly leading sports organisations will be looking to do that more individualised assessments so that they are able to make better decisions around each individual.
But Greg, 35% is an awful lot of athletes who need more than 11 days or 12 days.
It is, and the 21 days, which is now being recommended for community sport, and I understand why it is being, but 65% of those people were fine to return to play potentially after 12 days.
But I'm saying 35%. And beyond that, the coach and the club and the fans want that player back in the field, as Stephen says.
They do, and I think moving forwards that, we need to work towards being able to make more individual decisions based on objective data rather than blanket decisions based on more subjective information that's currently happening.
Absolutely. Any other last question?
One
please.
Thank you so much for the really interesting conversation. I'm interested in why there's this focus on concussion when the best science tells us that it's exposure to repetitive head injury over a long period of time, which is the risk factor. What does this technology offer for the issue around subconcussive hits, the subclinical hits that we know are causing CTE and other things?
We're not talking about concussion, a single concussion events at all. We're talking about brain health. Indeed, our business name is Your Brain Health. And outside of concussion, we're also looking at dementia, other neurological conditions like Parkinson's, and the whole spectrum of brain health. We're looking at tracking brain health annually through baseline testing. So whether there's a decline in brain health from a single, more significant event, or whether there is a gradual build-up in deficits to brain health due to subconcussive events, we would be looking at tracking both of those scenarios. So we're looking at being able to more objectively track and monitor brain health over a period of time.
Question up here.
Yeah, good morning, gentlemen. Ray, thank you. And panel, it's been great. What's the cost to implement? Is that the issue? Or is it the fear of the unknown on the sporting field, in the workplace, in volunteer organisations, simple as Surf Lifesaving, RFS, which I'm part of, which don't even monitor this? So is it the cost, which I don't know what these tests cost, or is it the fear of the unknown? Thank you.
Good question. I'd say there's organisations that are slow to adopt change, and if they are going to adopt change, which change should they adopt? So that's why we work really closely with Professor Patricios and the Concussion in Sports group, because we feel that that's the world's leading organisation in guiding where concussion management should move. And we ask them for a lot of advice and then a lot of our policies. So there is certainly a resistance to change by a lot of organisations. Just to give you a ballpark figure of what we charge, the more abridged version we charge $65 for, and the more comprehensive version we charge $95 for. As it's physiotherapists doing it, we do, for the more comprehensive screen, private health rebates will apply, but that's a ballpark picture for you.
Ian, can we finish with you? I always welcome your wisdom and insight on this. What have you got out of today? What did you get from the professor? Are we treating it urgently enough?
Well, it's now being treated as a serious condition, and there are serious consequences. And I think we can all agree in the room now that the evidence has played out, and it's taken generations of sporting heroes before us for us to realise now that this is an ongoing problem, such as Mario. I'm speaking about Mario's bravery in speaking up and speaking out publicly. Like those types of stories that they need to be acknowledged for how powerful they are. And it's particularly within the men's game. I still do feel like there's this is seen as some sort of weakness, or it's that real psychological thing with men. But it's one of those things that you got to keep poking the bear. We have to keep having these conversations. This is important stuff, and the research and the education is out there now, and it's quite evident of how serious the consequences of head trauma and repeated head knocks can be long term.
All right, thank you, Champ, very much indeed. Would you please thank Ian Roberts, Stephen Fenech, Dr. David Stevens and Greg Rosenbauer. Thank you, gentlemen, very much. And thank you all for coming.